And pretty much amoxicillin, if you don't know, is an antibiotic that is commonly prescribed by doctors to kill bacterial issues such as strep throat, that kind of thing.
Amoxicillin was discovered by scientists at Beecham Research Laboratories in 1972. Its original trade name was Amoxil. The narrow spectrum of antimicrobial activity of the penicillin led to the research for a new type of penicillin that could treat a wider range. This led to the development of a penicillin. Further developments led to amoxicillin with improved duration. The main difference between a penicillin and amoxicillin is that amoxicillin is more liquid soluble. As a result, amoxicillin may kill bacteria slightly quicker.
Amoxicillin may be used for the following diseases: anthrax, prevention or treatment of the skin version; urinary tract infections like bladder or kidney infections; peptic ulcer infections by Helicobacter pylori; chlamydia infections; Lyme disease transmitted by ticks; middle ear infections, also known as otitis media; pneumonia, lung infections; sinusitis; skin or soft tissue infections like boils or cellulitis; and bronchitis and pharyngitis, things like strep throat, tonsillitis too, and a number of others.
Amoxicillin is a penicillin antibiotic, and it's used to treat bacterial infections in the body. How it works is it blocks the bacterial cell wall production.
Amoxicillin is taken by mouth, either as a capsule, tablet, or as a liquid suspension. The regular release form also comes in a chewable tablet. These dosage forms may be taken with or without food.
Enough. You want to store the capsules in a cool, dry place. A closed closet is a good place to keep the medication. If you have the liquid form, that requires refrigeration, so you're going to want to keep that in the refrigerator.
Today, amoxicillin is the most popular antibiotic prescribed to children, usually in liquid elixir form. It's more versatile, better absorbed, and tolerated than older penicillins, and it's acceptable for use during pregnancy.
While amoxicillin is usually well tolerated, side effects may occur, including nausea, vomiting, or skin rash. Mild diarrhea or soft stools are also a common side effect with many antibiotics. This is usually temporary and will clear when the antibiotic is completed. However, if severe diarrhea, watery or bloody stools, stomach cramps, or fever should occur, even up to 2 months after completing therapy, patients should contact their healthcare provider as soon as possible. Patients with an infection may feel better before their antibiotic treatment is completed. However, the entire course of antibiotic treatment should be finished. This is important to help prevent the infection from reoccurring and to help prevent antibiotic resistance. Antibiotic resistance is the ability of bacteria to withstand the antimicrobial power of antibiotics. Simply put, antibiotics that used to cure an infection do not always work now. Completing your antibiotic regimen and not taking antibiotics when you have a viral infection, such as the cold or the flu, are 2 ways to help prevent antibiotic resistance. Amoxicillin belongs to a class of antibiotics known as aminopenicillins. It is chemically similar to penicillin but has a broader spectrum of antibacterial activity. Amoxicillin works by inhibiting the synthesis of the bacterial cell wall. It has activity against many gram-negative and gram-positive bacteria.
Middlebrook Pharmaceuticals is refining the delivery of amoxicillin therapy to form the first and only once-daily amoxicillin product, Moxitag, amoxicillin extended-release tablets. Moxitag is indicated for the treatment of tonsillitis and/or pharyngitis secondary to Streptococcus pyogenes in adults and pediatric patients 12 years and older. Utilizing innovative proprietary technology, Moxitag delivers the efficacy of amoxicillin in a once-daily dose of 775 milligrams for 10 days. Moxitag consists of 3 active components of amoxicillin: 1 immediate release and 2 delayed release components. Proprietary drug delivery technology enables a single dose of Moxitag to generate a progression of 3 staggered pulses that enables the prolonged release of amoxicillin from Moxitag. Pulse 1, the immediate release component, releases a portion of the total amoxicillin dose in the stomach. Then, as the delayed release components move through the gastrointestinal tract, they release amoxicillin at different regions. The delayed release of Pulse 2 is triggered by a change in the pH in the intestines. This is followed by the delayed release of Pulse 3 as it moves through the gastrointestinal tract. This specific ratio of the 3 components results in the prolonged release and absorption of amoxicillin from Moxitag. The unique extended release formulation of Moxitag utilizes proprietary technology to prolong the time from a single dose that amoxicillin exceeds the minimum inhibitory concentration, or MIC, for Streptococcus pyogenes, the causative pathogen for bacterial tonsillitis and pharyngitis. Extending time above MIC allows Moxitag to provide effective therapy at a lower antibiotic dose of just 775 milligrams of amoxicillin once a day, resulting in improved convenience, potentially leading to improved compliance and better treatment outcomes.